I'm Joy Lambert. You may know me as the new patient coordinator for Asheville Integrative Medicine. But did you know that I also help people get started with our hyperbaric oxygen therapy units? We call them HBOTs. That's right. When you're ready to rent an HBOT unit, I might be the one who's showing you the ins and outs of how it all works. Another fact you might not be aware of is that almost anyone can use our hyperbaric chambers. You don't even have to be an established patient with us. Our units are accessible to the general public for short-term home rentals and in-office sessions. Now, if you're scratching your head thinking, Hyperbara, what? I totally get it. It's a mouthful for me too. And when I first learned about hyperbaric oxygen therapy, I had no idea what it was. So I'm going to break it down for you in a way that I hope makes it easy to understand. The hyperbaric chambers are closed, pressurized environments that fill with room air and additional concentrated oxygen. Hyperbaric refers to the way the oxygen is delivered, which would be at a pressure greater than normal. The increased pressure and oxygen levels within the chamber help to increase the amount of oxygen within our blood. This extra rich oxygen plasma reawakens stunned mitochondria, which is the powerhouse of each and every cell in the body. The recharged mitochondria work to reduce inflammation and aids body tissues that are wounded or starved of oxygen due to a trauma or exposure to toxins. Spending time within an HBOT chamber is like giving a boost of healing energy within the body. These units aim to break the cycle of inflammation, oxygen starvation, and tissue death. Though research is still ongoing to learn more about the ways hyperbaric oxygen therapy can help, it is already approved by the FDA for several conditions, including, but not limited to, skin grafts, carbon monoxide poisoning, cyanide poisoning, diabetic wound healing, delayed radiation injury, thermal burns, and crush injury, also known as compartment syndrome. HBOT chambers have been approved for these conditions because they have been shown to increase oxygen intake in cells, aid in circulation, vasodilate, assist with detoxing, enhance white blood cell action, increase energy, rejuvenate skin cells, and increase endurance. Is this all making sense? If not, you can send any questions you may have to us through our contact page on the AIM website. I'm happy to help you with your answers. Now, what do you need to do to rent one of our units? All you have to do is call the office and I can screen you over the phone at no charge to make sure there's no medical contraindications. Safety first, after all. Once you're cleared, you'll have the option to either set up a home rental or have your sessions right here at our clinic. Our home rental chambers are shaped like giant inflatable cylinders. You'll lay down on either your stomach, your side, or your back, like this. You can take a nap, read a book, or meditate. If you choose a home rental, you'll come to the clinic to go through your first session with us so we can show you and whoever's going to be helping you at home how it all works before loading one of our portable chambers in your vehicle. With home rentals, you can borrow the units for either 2 or 3 weeks at a time. If you'd like to have in-office sessions, then you'll get to use our newest HBOT chamber, which we call the pod. Let's go check it out. As you can see, this chamber is pod or tent shaped. Because this chamber has a 5-foot diameter base and a taller ceiling height, you can either sit up in the chamber or spread out comfortably on a large cushion like this. With our 2 different kinds of HBOT units, we're sure that you'll find something that suits your needs and comfort levels. So, are you ready to try this incredible therapy? If you'd like to learn more, give us a call and we'll gladly answer any questions you have. And when you're ready, get you scheduled for your first session.